Dr. Leigh, have you, what do you say about, sleep apnea and how sleep apnea apparently is affecting more people in terms of having car accidents, deadly bad car accidents on top of it, than drunk drivers? Simply because people cannot quite sleep. They wake up many, many times throughout the night. Most of the time, not always, but apparently snoring has a big part of it. Basically, people who do snore have a tendency to have sleep apnea. Not a necessity, but it's a good precursor to a good, and people are tired and exhausted. So if somebody's kind of tired and exhausted in the afternoon and feels like passing out in, the early afternoon and thinks he needs a coffee, a Coca-Cola or a Red Bull, and at the same time, if he knows he snores because his partner tells him so, sleep apnea is a good chance that he has. Now, what do you say about it? And tell us what does a dentist have to do with sleep apnea?
Well, we cannot diagnose sleep apnea, but we can refer the patient to a sleep center to have a sleep study done to determine what type of sleep apnea, whether it's a mild case, moderate case, or severe case. Once it's diagnosed, the physician will determine what the best course of treatment is, and that could be either an oral appliance or something that they wear in their mouth, or it could be what's called a CPAP device, which is essentially oxygen that's being introduced or forced down into the down the throat or up the nose. Something that they wear. It's a mask that they wear, so it's not always the most comfortable thing, which is why some patients prefer to try that oral appliance first, because it's just it's not this heavy machinery where they have masks and tubes coming out and actually
I've heard it's the other way around. People take this CPAP machine, which puts pressure and just puts normal ambient air in the mouth, and by doing so, avoids the sleep apnea. They try that first. It's relatively expensive and definitely very uncomfortable, very difficult to move around if you travel a little bit.
Sure.
Doable. They make them small enough for you to do it these days, but still very uncomfortable and definitely uncomfortable to sleep. You kind of have to sleep on your back and etc. So actually people have heard try that one first, since the medical field, it is the golden standard. However, like with exercise, any exercise is better than no exercise. There may be an exercise or two which are better than what you do, but boy, it's better to do something. So this mouth insert, that's people actually can stand it. They can easily take it with them and travel with it. So they quite often do that after, simply because they know they need something. They can't stand the standard of care, so they go to the slightly second best, which immediately becomes, because of it, the very best, because at least with that they're able to sleep.
Sure.
So
that's what you heard.
Yeah. So let me ask you, when a person wears this, let me ask you, let's just say a person, as I described before, he or she is, getting tired, snores. Maybe his or her partner even says that he has a feeling that he sometimes stops breathing, because that can happen dozens and hundreds of times throughout the night, for a few seconds, up to a minute, whatever. Would it be all that bad? Does a person really need to have a sleep apnea test? I mean, he snores, he's tired, is exhausted. Why don't you just get that appliance? Because at the least it will reduce the snoring, won't it?
At the least it will, but I personally think it's better just to, if they are tired, if they're displaying signs of sleep apnea, to just get diagnosed and get tested.
Okay.
And it's better off to have them see the physician.
Okay, good. All right. So go get tested, and then get one of the two, or even both, so that when you travel or when you whatever it is, you have the other one too.
Yep. You got backup, exactly.
Have the backup, because sleep apnea. Tell me whether that's true. I heard that it's a little bit like with eyesight, with glasses. If you need reading glasses, like I do, if I don't have them on, I have a hard time seeing what's here. It's just, but the second I put them on, I'm fine. The second I take them off, I'm not fine. So it's not like with other medicines or foods or treatment which has a lasting effect for whatever that may be. This one is you wear it, it functions. You don't wear it, it doesn't function. Is it true that this how it works with sleep apnea?
Well, yeah, I mean, it's a great analogy, you know, where someone, I recently had a patient who it basically said to me, you know, my wife complains that I snore, and we talked a little bit more, and I recommended getting a sleep study. 6 months later, in a hygiene chair, he said he went through the sleep study, and it's just made a huge difference in his life. He does use a CPAP device, and but again, like you said, it's like putting your glasses on and everything is crystal clear. And I mean, he was very thankful, and that was just a suggestion that I made to him, and but it happened to be a life-changing suggestion for him. So yes, absolutely.
Well, I can see why, Dr. Leigh, because, you know, if a person doesn't sleep well, wakes up constantly, there are many, many studies out there. If they wake you and me up when we sleep, and purposely, every time we start sleeping, they wake us up after every few minutes, it will take very little time till we get very cranky, very irritated. And if you keep it up for too long and too much, we'll get insane. Sleeping is one of the biggest, sleep deprivation is one of the biggest problem for, you know, thinking clear and being relaxed, sure. and of course being alert, and all those type of stuff. So if a person has that, it makes a huge difference in life. Never mind the noise he makes for snoring with his wife, which is probably bad enough, but during the day, the way he feels, and he probably doesn't even know it. He thinks he's getting old. He thinks he's having some other problem, and probably goes to doctors and gets all kinds of medicine and as a, you know, sugar and energy drinks, and when it doesn't do it. Yeah. So I can see why your patient goes, "Wow, this is life changing."
Yeah, and you mentioned the wife or the spouse. I mean, it's life changing for them too, because they're able to get some sleep.
Yep.
Because they're not having to leave the room because their partner is snoring. So, yeah, it's a really bad problem, especially if you compare someone who's sleep deprived to a drunk driver. It's basically you have someone with a similar their ability impaired in the same way. So, and there's a lot of people on the road who are sleep deprived.
Right. Well, they're only now finding out in the medical studies, because they have known sleep apnea exists for a long time, but I don't think they knew the severity of it. Why so many people of us are having problems we don't think. And look, I mean, how many problems you dentists really fix? It's unbelievable. Like, for instance, people have a headache, and they look to a neurosurgeon, they go all kinds of places, which is, you know, good and all those things you want to eliminate. But one thing they still very often don't go for is the dentist for a DMJ, like, you know, the jaws, the missing teeth, like it's just not quite aligned, and have a headache. I mean, who would think so? You understand?
It's true.
So there's so much related to it, and the medical field only now found out that some of that exhaustiveness simply comes from, you know, the guy doesn't sleep. Because if you ask him, you say, "Oh yeah, I sleep about 8-9 hours a day. I go to bed at 10. I wake up at 7, and I'm fine." What he doesn't know, what he doesn't tell, because he doesn't know, is, yeah, but I woke up about 45 times during that time, minimum, if not 200 times, because I don't remember it, but it would have interrupted the sleep, so he never goes into this beautiful, I don't know what they call it, you probably know, this deep sleep or whatever. You know, this...
delta sleep, yep.
Yeah, this stage kind of 2. Well, all right. I hope this was informative, because it surely was to me. Thank you very much, Dr. Leigh.